If you have been grappling with chronic pain for what feels like an eternity, and if you have hopped from one doctor's office to another in search of a solution, then this is for you. You will be astonished how a simple cold therapy can be a game changer. In this video, we are going to dive deep into the incredible ways cold exposure can be your ally in the battle against chronic pain. Welcome all newcomers to Ice Mind Body. Our mission is simple: to provide you with comprehensive insights into cold exposure and cold therapy, and to empower you on your health journey. Today's spotlight is on chronic pain because it's what personally brought me here. My own struggles led me down a path of investigation and experimentation. When it comes to conditions like fibromyalgia, rheumatoid arthritis, or certain autoimmune diseases, traditional medical options often fall short. But before we dive into the subject, a crucial disclaimer. Pain is your body's way of signaling a problem. If you're experiencing recent pain, consult with a medical professional. And if you're on any medication, never make changes without your doctor's guidance. However, if you have endured pain for over 6 months, have been examined by specialists, and ruled out serious conditions, then stick around because we have got valuable insights to share. Now, let's zoom in on the specific types of pain we are addressing today. Inflammatory pain, like certain autoimmune conditions, such as body myositis or rheumatoid arthritis, and nociplastic pain or central sensitization, common in conditions like fibromyalgia and chronic fatigue syndrome or CFS. In these cases, pain tends to be more constant and duller rather than sharp and intermittent. So now let's put our spotlight on cold exposure. A study was conducted in October of 2018. It involved 60 patients diagnosed with fibromyalgia, randomly divided into 2 groups. One group underwent whole body cryotherapy or WBC, where they were exposed to bone chilling dry air for short periods, while other group was served as the control. These WBC sessions took place every other day for 3 weeks. The results were remarkable. The WBC group experienced significant improvements in pain levels, the impact of disease, and the severity of fibromyalgia. What's even more impressive, these positive effects lasted even after treatment concluded. Now, let's dig into the scientific mechanisms through which cold exposure can be a potent weapon against chronic pain. First up, inflammation. Cold's effect on inflammation is well documented. Cold exposure triggers vasoconstriction, causing blood vessels in the affected area to narrow. This reduces blood flow, limiting the release of inflammatory substances and immune cells into the injured tissue, which can be especially beneficial during an inflammatory flare-up. But there is more to it. Cold therapy also slows down cellular metabolism, including the production of inflammatory mediators. Each cell in your body carries out metabolic processes to function. Inflammation often leads to an increase in metabolic activity in cells within the affected area. Cold application cools the tissues, slowing cellular metabolism, reducing the production of inflammatory mediators, and dampening overall inflammatory response. Additionally, cold therapy provides pain relief by numbing the affected area, reducing nerve activity, albeit temporarily. It can help decrease perception of pain and provide temporary relief from discomfort tied to inflammation. Although this relief is short-lived, it can be a blessing for those battling pain around the clock and can significantly impact their mental well-being. But here is where it gets interesting. Cold exposure can also result in the production of hormones like epinephrine, norepinephrine, and cortisol. Epinephrine steps in with its pain-relieving effects by interacting with the body's adrenal receptors, found on nerve cells and involved in pain regulation. Activation of these receptors can lead to pain relief by inhibiting pain signal transmission, constricting blood vessels, and enhancing the release of endogenous opioids like endorphin, the body's natural painkiller. On the flip side, we have cortisol, known for its anti-inflammatory properties. In cases where pain is closely associated with inflammation, cortisol can help reduce inflammation and consequently pain. Furthermore, cortisol can modulate pain perception by interacting with certain receptors in the brain that affect pain processing. Before we continue, if you're as passionate as I am about cold exposure, hit that like and subscribe button. This is a new channel and I'm committed to building the most comprehensive library on cold exposure and cold therapy, where I will be sharing all my knowledge and experience. But here is the fascinating part. Central sensitization, the heightened sensitivity to pain and pain perception, is often the major hurdle to overcome. Keep in mind that the brain is remarkably adaptable and can change over time with persistent practice in altering how we feel and think. That is called brain plasticity. This is where cold exposure can play a significant role. First, regular cold exposure can influence pain thresholds, essentially making individuals less sensitive to pain. This shift in pain sensitivity can lead to a perception of reduced pain. Think about it. When you first plunge into cold water, it's undeniably painful. But over time, your body adapts and becomes less sensitive to that initial shock and ongoing discomfort. Now, remember that numbing effect and temporary relief that we talked about earlier? Well, they can continue to influence pain perception even after initial numbing wears off. Engaging in cold transmission techniques can serve as a welcome distraction from relentless grip of pain. Additionally, the sensation of cold can trigger the production of dopamine and serotonin, neurotransmitters that promote relaxation, happiness, and an enhanced mood, all of which can have a soothing effect on pain. As you might already know, cognitive behavioral therapy, or CBT, is one of the methodologies used to address pain perception. Essentially, the more you focus on your pain and the daily struggle it brings, the more intense it can feel. It's not just in your head, obviously. The pain is real, but your thoughts and feelings can magnify its impact. Cold therapy can function in a similar way by helping to normalize pain sensitivity and perception. Now, let's be clear. Cold exposure isn't a magical cure-all. And in fact, there is no single jab or remedy that can wipe chronic pain away in one go. However, it is an immensely powerful tool. When used in conjunction with proper nutrition, targeted exercise, and other mental training techniques, it has the potential to significantly minimize or even eliminate the shackles of chronic pain from your life. In future videos, we will delve deeper into the worlds of nutrition and exercise focused on addressing chronic pain. So stay tuned. If you're intrigued by the prospect of giving cold therapy a shot, be sure to check out these other videos here for insights and tips. Don't forget to show some love by hitting that like button and subscribing to our channel for more content. Wishing you the best of luck on your journey to recovery, and until we meet again, stay cool.